Hey everybody, my name is Dr. Banimahd, often called Dr. B. I'm the Clinical Director of Wound Care OC, and I want to give you a little something to think about. And it's really a question of why are we different than other wound clinics out there? And in addition to that, I'm often asked to do some educational videos, but for that specifically to talk about diabetic foot ulcers, we've created a YouTube channel for your edification so you can update yourself on all of that stuff. And that's no different in understanding what a disease process is and what the care seems to be. But I think there's something extremely different in what we do, and that is our particular expertise and passion for chronic disease management, which is sort of non-existent out there. Why is that important? To approach a chronic disease as such creates much better healing and rectifying the clinical disease process than if you didn't. And in a world of healthcare where nobody knows anything about patients anymore and we're constantly handing patients off, when you deal with chronic diseases, it actually creates a much bigger problem than it does with acute situations that need to be dealt with. And I would argue that even in those, we are lacking in information and long-term thinking to care. Let me give you a couple of examples that we've had recently, and this happens all the time. We just recently had a gentleman sent over to us, and he's in his 80s he has diabetes, and he had a chronic traumatic wound in his thigh. I'd been to multiple places, and this is a very educated gentleman that who can follow directions, and it just wasn't healing. And they just had it. It had been going on for months. Well, he comes to us, and we didn't just look at the wound. We looked at his diabetes. We educated him. We followed him closely, and we also used the latest and greatest techniques in approaching and managing the wound. It got healed. We had another lady with decubitus ulcer because she was bedridden, and we sort of did the same thing, and we managed the wound. So it's not just what is applied at the bedside, and sometimes that is done wrong. It's understanding how to approach a patient and how to apply all of the tools, both as a professional and as a so-called expert in any area, in addition to understanding that we're not dealing with a factory line that creates and produces results. So I would say that is the difference with us than other wound clinics, and the results occur, and in fact the science tells us that it should be approached that way to get good results. Just something for you to think about. Try us out. Talk to your vascular surgeon, talk to your primary care. If you have a chronic wound that's not healing, we think we can do better than the next guy. In fact, we're certain of it. And it has to do with the relationship that we build with you, the education that we give you, and a sort of all-around holistic approach to managing your particular wound, as well as your particular needs in your life, whether it's mobility issues, time issues, financial issues, whatever it is. We feel that clinicians should approach the patient in a much more holistic way. Thank you for listening to me. I hope to come back on here and give you some more useful information, and we hope we see you at the clinic so we can take care of your wound. Have a great day.